So one of the most common complaints that people come into my office with are their nasolabial folds, or some people call them their smile lines. And a lot of people's first instinct is to put a bunch of filler right here. But a lot of times, if you may have experienced or you may have seen, that can kind of lead to what I call the Homer Simpson look or the bulldog, where you're really full here in the center of the face. And that's because by doing that, you're treating the symptom, not the problem. And you always want to treat the problem, not the symptom, because that's what's going to give you better results. You don't lose much fat here as you age. There's not really a fat pad right here. There are fat pads here in the deep piriform space, here in the middle of the cheek, and here in the lateral cheek. So I always try to fill those first. I'll put a light amount of filler here to lift up and a little bit back here if needed to lift back. And then we will go in with maybe some piriform filler, and then last is always going to be filler in the nasolabial folds. And that is how I'm able to get soft and natural results that lift those nasolabial folds a lot more efficiently, because you have more structural support to get that tissue out of the way. And then in the very, very end, if we need a little bit here, we'll put some there. But always remember, nasolabial folds are not a bad thing. We need to stop being so terrified of them. Babies have nasolabial folds. As I saw one doctor put it several months ago, having nasolabial folds is like having cleavage. If you have breasts, you're going to have cleavage. If you have full cheeks, you're going to have a nasolabial fold. So if you'd like a consult about your nasolabial folds, come on in.